Oktober maand, dit is die maand Oktober, die mooiste maand. Dat is die dag so helder, so groen as elke aand. That was a poem that we started a long time ago. October, the National Breast Cancer Awareness Month. It is our time of the year when we pay attention and focus on this important organ. And this time, we'll be looking at breast lumps, how to identify them and what to do with them once they've been identified. Good morning and a very warm welcome to Bonitas House Call here on FCB2. I'm Dr. Victor Ramatesele. Now, we welcome to invite you to join our discussion by calling us on 083-913-4687 with your questions and comments on breast lumps. Or you can send your SMSs to Bonitas at 33723. But first, I guess and hear this report about breast lumps. Let's watch.
Many women may find that their breasts feel lumpy. That's normal and shouldn't cause alarm. But when lumps feel harder or different from the rest of the breast or the other breast, it should be checked. This type of lump may be a sign of breast cancer or a benign breast condition. Breast lumps can be caused by infections, injuries, non-cancerous growths, and cancer. Consult your doctor if you find a new breast lump. A new breast lump or breast pain doesn't go away after your next period. An existing breast lump gets bigger or otherwise changes. If you notice skin changes on your breast, if you notice changes in your nipple, it turns inward or appears flatter, or you notice spontaneous nipple discharge from one breast that's clear, yellow, brown, or red. There were 1.7 million new cases of breast cancer in 2012 worldwide. Early detection is one of the most important ways to manage or prevent getting cancer.
Early detection. As always, we're invited to the studio today, Dr. Carol N. Ben, who's professor of surgery, and she'll tell us a little bit more about what she does. And we also have all the way from KZN, Dr. Thandeka Mazibuko, who's a registrar, a specialist in training in the radiology oncology, and nominee for South African of the Year for 2015. Let's get to the matter now. Thank you, ladies, for joining us this morning. It's October month, as I said, a very important month in the health calendar of South Africa where we focus on breast cancer. But I don't want us to talk cancer too much today. I want us to talk about breast lumps. Dr. Mazibuko, you've done a lot of work in the communities. What is this organization that you founded again?
It's called Sinomusa Nothando Community
I
Development.
don't, you're saying it too fast. Come on now. What is it again?
Sinomusa
Nothando.
Which is the role of medical doctors to be generous and to care. That's exactly what we are. A group of doctors who say we'll go beyond our call of duty. We'll see patients during the working days, but on our weekends and our leaves, we extend ourselves to create an awareness of cancer, especially breast cancer, cervix, prostate, and GIT cancers.
Now, intombazane yakwanyuswa. Umwelasa kaMazibuko. Ungena ngani uxhuma ngaphi wena kule zinto zomdlavuza ngoba usemncane nje abantu abangodokotela fana abanye bayafuna ukwenza izinto abantu babuke bebahle abanye bazo dermatology and such like.
Yeah, it's a very good question. Ukuthi nje kuze kusukephi. I was the first black in oncology to specialize because I realized there's a need and I had passion for oncology, which means extended care for a patient. Because in oncology, once a patient comes through your door, they never leave you. They're with you forever.
So they have an incurable disease, pretty much, which is cancer,
Yes, it needs constant monitoring for the rest of your life. That fascinates me. The other thing that is very fascinating is the science that's involved in oncology and the physics that's part of the machines that we use. It's very fascinating for a doctor who's a scientist. I come from a BSc background. That attracted me.
So now, Dr. Carol N. Ben, I mean, your name precedes you. I mean, you've done so much work in this country, and I mean, I cannot thank you enough for the work that you have done and for the support that you have given us on Bonitas House Call in our quest and attempt to try and educate South African public. Now, let's get one thing straight. Am I correct to suggest that although most of the breast cancers will present as breast lumps.
Yes.
The majority of breast lumps are not cancerous.
Absolutely, absolutely. And I just want to take a minute to give kudos to the youngsters who are coming up and are making such a huge difference, because it is about that. It's about education, which is why Bonitas is so important in the community. It's about not fearing if you examine your breast and you feel a lump, because most times it's not a cancer. But if you feel
Can you please
something,
repeat that? Because that's what we want to say today.
times when
Most times that lump is not
when you feel a
cancer.
lump, it's not a cancer. So do not be fearful and seek help. Come in and go to good government units for an ultrasound, so that you have peace of mind in knowing what it is. Because why do we see big cancers? It's because people pick up lumps and they're too fearful to come forward to seek medical attention. So it's your body, it's your temple. And by doing that, you must know your body, and if something's wrong, if you feel something, a mass, most likely not a cancer. If you see a discharge from your nipple, most likely not a cancer. But come in and seek help so that we can allay your fears and find out what it is.
Before we look at the next incident, uma ngabe abantu abanomdlavuza webele uqala uze nesigaqi, pho yindaba abantu abaningi bangaka befibeza sekulate somdlavuza
inkulu indaba leyo, ngoba thina abantu besintu siyathanda ukudembesela into yokuqala. Okwesibili, sineyinkolelo ukuthi mangibona isigaxa, umuntu wami oqala engizoya kuyona mhlambe umakhelwane umthandazi noma nansi inyanga yangasekhaya. Nansi enye into esiyenzile thina Dr. Ramatesele, sitheme sesifundile, we completely ignored our community, we moved to the suburbs and the community are left alone. And the people they find in the local communities are the pastors, then it becomes religious issues, the sangomas, then I will consult my sangoma and whoever is around, because the doctor is too far, they wait too long to come to us. Sometimes
now these two ladies, they both come from different parts of the country, as we've heard, but they also have one thing in common, and that is passion and passion and passion for women's health. And today we are talking about one specific item of women's health, which is breast cancer. Let's watch.
You know, what I wanted to speak to you about, Professor Carol, is that a lot of the time, as much as we're familiar with breast cancer, there are elements of it that might seem like common, but people still need to understand. So I wanted to find out from you at basic level, what exactly is a breast lump?
So let's talk about what happens when cells undergo change. So we all have cells in our body, normal cells, abnormal cells, alive cells, dead cells. Abnormal cells will undergo change, and if they're not killed by the body, they can develop into different things, such as breast cancers. Okay, so what happens with most breast cancers? They start small and they grow and they present as painless lumps. So most women don't realize it's a breast cancer because they say it wasn't sore. Breast cancer can present in other ways, such as a red hot inflamed breast, or a scratchy change on the nipple, or big glands under the armpit. But the message to the community is, if something doesn't feel right, come forward. So most lumps in people of any ages are not breast cancers, but doing something as simple as a breast ultrasound can tell us what it is. And if we're worried in any way, we can do a core needle biopsy, a small needle biopsy that tells us what it is. So the second message to the community is, don't rush in and find a surgeon to cut things out. Find out what it is, go to an appointment with a friend or family. 4 years always better than 2, particularly when you're talking about things such as medicine that you are not sure about. And listen, it is your body. You're entitled to second opinions, time to think. But what we don't like doing often is losing people with breast cancer out in the community. So often what we've seen is, over the last 10 years, we've been able to drop the incidence of big advanced cancers in the country from 80%, and these are cancers that are over 5 centimeters when people present, to now 60% of the women we see. So that's great.
Very interesting now that we are talking about breast lumps, and we said most of them are benign. In other words, they are non-cancerous. Quickly now, let's get into them. Now you have fibroadenosis and fibroadenoma.
Different things. So fibroadenosis is a lumpy breast, and it's a pathological, which means you see it down the slides, when you look at pathology. So for most women in the community, forget that. You either feel a lump pain or a nipple discharge. If it's a lump, it's commonly a fibroadenoma or a cyst. It can
If
be
it's a lump, it's a fibroadenoma.
noma, which is a benign lump, or a cyst,
Okay.
yes. Can be really lumps that grow quickly, phyllodes, or unusual tumors in the breast, and then it could be a breast cancer. If it's a nipple discharge, it's either due to inflammation, or we can have a little growth in the duct called a papilloma. And breast pain is commonly not cancer unless you have it with another symptom, like a red hot inflamed breast.
Okay.
So most things will not be, but we do see an increase in cancers in our young girls that mimic fibroadenomas. So my message is find out what it is, not with an operation. I am very, very strict in the fact that there are too many surgeons who run in and cut into things. We don't need to do that. We can do something simple, such as an ultrasound.
We'll talk about that later. We'll talk about how you approach it.
Yeah.
But the main thing is that a lot of young women there, sometimes even during a normal month, at some point during the month, Baba nazo igaqanyana and feel that there's something that's happening there. Now, the main thing is that how do you differentiate if you've got, for want of a better word, a normal, breast lump and a one that is cancer? How do you differentiate between the two?
The cancerous lump is usually irregular in shape. Usually the one that's not cancerous will be uniform.
Okay.
And you
It will be
cannot,
nice
you
and smooth
cannot really.
when you hold it, yeah.
But my advice to the community, because you don't know when you're at home, we rather just take every lump as a serious lump and you present it to the doctor. That's my advice.
Yeah.
Because whatever information we may share here, it's for medical doctors who may understand, but for the community, any lump you feel, take it as a lump that needs to be seen by a doctor.
Okay.
Then let the doctor tell you whether is this a cancerous lump or not, because merely by palpation you cannot tell. You need further investigation to be able to tell what's going on. I like to warn at the local clinic, sometimes it happens that a patient presents with a lump, they give antibiotics, which is a very common phenomenon. When you see a lump as a medical student or as a nurse, don't rush into treatment. I always say, don't wipe the water until you close the tap.
I see.
So close the tap first, then go and wipe the water. So don't give antibiotics until you know what you're treating. And those are the people like Prof who can help us. Even in oncology, I can't tell what lump am I seeing.
Neither can I.
So I say as a breast examination, sesibeka ngesizulu sithi wena usekhaya uma ngabe uzizwa engathi kunekhona isigaxa la ebeleni lakho yize igaxa eningi kungewona umdlavuza phuthuma uye kwemtholampilo utshelwe unesi noma udokotela ukuthi ngempela lesigaxa unaso wena
ngabe yiso yini
akubona umdlavuza.
Enye into engiyaye ngisho ke ukuthi bantu basemakhaya musana ukulinda thina singodokotela sizothinta ibele lakho zithintele wena ibele lakho. Izolo nje besibatshela lapha ku-Prix likaSem eThekwini, we're doing a walk, siyanifundisa ukuthi lihlolwa kanjani ibele ukuze ulithinte kanye ngenyanga. Touch your breast once a month. It's your breast, it's not mine. So you touch it at home and then wait for me to touch it once a year, but every single month, but touch it after your menstruation. As you mentioned, mangabe usesikhathini lithi ukuba neyigaxanyana ongeke uzizwe kodwa umuntu olijwayele ibele lakho uyokwazi ukuthi hayi lezi igwaxa ngizwile last month this month lezi ke lezi hayi zinomkhonyovu phakathi kodwa akuwona umloyo awuloyiwe
akulona umloyo waneso khoba mathafu netobebe losikhotlolongo. We'll take you through the clinical approach to a patient with a breast lump. Hanganga re khotla papatso.
Oh God. Not now. Oh, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Again, Mama.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Guys, ga wana tlega le seng go gorogile ka tlhamalalo mo thulaganya gago ya mmamorato e leng Bonitas house call ga go legana go golagana le rona ka tlhamalalo mo norong ya 0113264740 kgotsa mafaratlhatlha SMS fumula ka Mazibuko Bonitas and then 33723. But first, let us look at what questions to ask, how to examine, and what investigations and treatment are conducted on a patient with a breast lump. Let's watch.
What also helps is that we try and take away the fear around different treatments. So a lot of the time people will start with chemo and we can shrink the cancers down. So we have at least 4 ladies waiting today who've come off chemo, who presented with big cancers and are now eligible and going to have a breast saving operation. So it gives people that realization that you're coming forward and you're changing what happens from a treatment point of view. And about 9 out of 10 ladies with breast cancer we see are still alive 10 years down the line. It may be that cancers have come back, but there are such big breakthroughs in treatment today, particularly in oncology. And oncology is the umbrella under which all treatment fits.
Yes.
So everyone will have some form of medicine to treat cancer. Most people will have surgery, either first or after the chemo, and a lot of people will get radiation, which is not a scary treatment, but it's difficult because it requires coming every single day for 6 weeks. So we have counselors trained who have specific interests, who speak lots of different languages and can talk to people. I've been through it, but I'm going to tell you in language that you understand what it's like to go through chemo, why you are going to be fine, why if you lose your hair it will grow again, and that's so important.
Fantastic. So you've explained to me already that if you have a lump and it's a cause for concern, there's no shame in going to get it checked out, just in case.
Always check it out.
And then you explained a core needle biopsy.
That's right.
At what level are you at when a mammogram is recommended?
So by the time you're over the age of 40, we prefer people to have mammograms and not sonars. Okay. So again, there's no screening in this country, but what we do have is we have access to very good digital mammography, the same as you get in private. So if somebody again has breast pain or feels something, she comes in, if she's over 40, she gets a mammogram and an ultrasound, and if we see something concerning, a core needle biopsy.
Oh, can get scary. But let's get the scary part out of the way. If you are going to investigate a breast lump, what do you start with? Is it a mammogram or an ultrasound, or it depends on your age?
It depends on the age. So in the youngsters, we start with an ultrasound if you're younger than 40 or younger than 35. And if you're older, it's a mammogram and an ultrasound.
Why?
Because young women have dense breast tissue. You can do mammograms in youngsters. So in the youngsters, and I've picked up 23-year-olds with breast cancer, we usually pick it up on ultrasound and we will also do a mammogram. A mammogram looks for different things. It looks at the density of the tissue and little calcifications, and an ultrasound is best to assess a mass, what something is, and it can tell you whether it's solid or it's got cystic elements. So that's why we do the different things.